Hello, everybody, and I hope you guys are having an awesome Wednesday. We are here today to talk a little bit about physical therapy. And, I have Rob here from Ascent Physical Therapy, and I think we're going to have a really cool conversation. And if you guys have any questions, as always, you can put your questions in the comments, and we will do our best to answer them. If you guys want to invite anyone to watch this live, be sure to send them the link, share it with them, and they can also ask their questions. Without further ado, I'm going to bring Rob on, and we'll hear a little bit about his background. So, hey, Dr. Rob, how you doing?
How's it going, everybody? It's good to be here.
Welcome, welcome, welcome. How's your day going? How's your week going? I think it's Wednesday. It's a little fuzzy here and there with the way the world goes today.
Yeah, everything's doing fine. It's a good week. I'm glad that the weather's been great. I'm glad that everybody's starting to get back outside. I wish a little bit more mask wearing was happening, but it is what it is for right now.
This is true. This is true. So, Dr. Rob, I would love to hear a little bit more about, your background, your business, and kind of how you got into physical therapy.
Yeah, so my journey started back in high school. I was trying to figure out what I wanted to do with my life. Even that early. I know some people don't really have that, and that's completely okay. But I was already starting to figure that out, and I started volunteering at that point. I took anatomy in high school, and that's kind of where I wanted to take it. From there, I went to undergrad at Sacred Heart University, got my bachelor's degree in athletic training. So my background with athletics has been very expansive, especially collegiate sports. And then on top of that, I went to Stony Brook University to get my doctorate in physical therapy. And from there, I worked for a local physical therapy company on Long Island, and I worked there for about 5 years. And what took me into my business was more from the lines of, I felt like I stopped growing, and the vision between the company and myself was kind of different. I felt like patients and people were not getting, not necessarily because of the company's fault itself, but because of the way insurances have been dealing with people lately, between premiums, co-pays, and everything else like that. That's a whole completely different story if you do want to get into that, Celia. But yeah, people weren't getting the quality that they needed, and also the length of time that they needed in order to get it. My kind of breaking point was when I had a meniscus tear patient, and he was seeing me for 6 visits and got denied by his insurance, and he was pissed off because he pays thousands of dollars a month for his family to have health insurance that's supposed to cover him, and he wasn't getting the care that he needed, even though that everything I was doing was medically necessary. And then on top of that, I had a rotator cuff repair patient, and you're supposed to only start strengthening them around month 3 after surgery, and she got cut off on month 3. So she had an arm that she can still barely lift. She can move it if she uses her other hand to lift, but she was not able to use her hand on her own, and she was unable to pay out of pocket, and she didn't have what she needed to do. So I felt for the people like that. I felt for people who need the education in order to make themselves better as a whole, preventative-wise, injury-wise, just so that they're able to get the care and life that they want to have.
Of course. And I actually, I'm very familiar with the world of physical therapy because my dad does orthotics and prosthetics.
That's cool. I almost got into orthotics and prosthetics at one point.
Small world. For people that don't know what orthotics and prosthetics is, it's braces, and if you lose a limb, the actual prosthetic limb. Also, you went to Stony Brook. Do you know Eric Lamberg?
I do know Eric Lamberg. He is a great prosthetist and orthotist. So I loved his class. He was my professor for that class. He was the one who almost got me into it. The other experiences that I had during school and throughout kind of drew me away from it, but maybe it's the future, who knows?
Well, I've known Eric for years and years. He actually has my dad come in lecture sometimes, so you may have seen my dad before. Mark Werner, and I've even shot Eric's son's bar mitzvah. So small world, right?
Yeah, small world.
So getting back to physical therapy, why is physical therapy so important? You were mentioning like people with different injuries and kind of working with them, but why is this such an important, I guess, a job, a career? Why is it so important to you?
Yeah, so I mean, this can be a very loaded question, and I can take it a number of different ways. Just because most people don't even know what physical therapy is, they don't know we exist, and usually the people that do come see us is only because a doctor told them to come see us. But most people don't need a doctor to come see us. As far as New York State goes, you can come to me as someone off the street, whether you have an acute injury or a chronic injury. And as long as you don't have any red flags of like you feel completely unwell, you're unable to sleep for 24 hours, feel like you have arrhythmias, that kind of stuff. Any of that red flag stuff, then I just send you back out. But otherwise, you can see me for 10 visits or 30 days, whatever comes first, without a prescription from a doctor. And that's what most people don't know, that we're open and available to anybody. But most of the time, people don't even know what we do. When someone mentions physical therapy, they mean, oh, the torturers, or the people that put me on heat and stim and just leave me in a room. And that's not what we do. It's not the ones that stretch or just give you a massage either. It's the people that, sit down and listen to you, like what we're doing right now. Because of COVID, I've had to go virtual, and this is how a session works. I sit down, talk with you, and work with you about your specific needs, whether that is a prevention kind of thing, whether it is an actual injury, or if it's something that you want to do health and wellness wise, based off of the way that my business is designed, giving you what you want in your life so that you're able to do what you love, and trying to do that with the quickest amount of time possible. I mean, a lot of times people wait, but for me, why wait in pain when you can get fixed tomorrow or today? A lot of the treatments that we do are mostly painless. There is some level of discomfort that can occur, but you should not feel worse when you walk out of the sessions. If you feel like you're feeling worse when you walk out of a session with one of us, either your physical therapist did not listen to you, or you did not communicate with them effectively. We work with you in order to give you the results that you want. We're not personal trainers. We're not exercise physiologists. We are a specific group of people that run the gamut. I mean, we treat people from life to death in the neonatal rooms to until we get to hospice. And we go from hospitals, we go to homes, we go to sports, and we're everywhere. It just depends on if you're good enough to look. A lot of the people that do end up walking into a regular physical therapy clinic are usually only about 3% of the population who are in dire need of help because they're in so much pain they can't deal with it anymore. But there is another 33% of people out there that I know who are sitting at home, possibly listening to this, that could need help right now, but still feel like they're not ready for it. Number one. Two, they're not sure if they're appropriate to be helped. Or three, they just want to see if it goes away. And most of the time, it doesn't go away. Sometimes the pain will go away over a period of time, but that's not happens with everybody. If you're having pain for months, it's already too late to continue waiting. You need to get some level of help, just so you're able to continue living your life. Because once you continue making modifications for your life and you back that off and you continue backing off the things that you love to do, you're already putting yourself into a decreased quality of life. And that's what I hate to see with most people. I want to make sure that you're able to live your life to the fullest and keep you moving.
Sorry, I turned my AC on for a second. I was like, oh, he's talking. But that's amazing. And, it's something that people don't really put thought into. Let me turn my AC off because you probably can hear that. But it's not something that people think in the forefront of, like, hey, my pain's not that bad, or it can't be that much of a problem, or things along those lines, which kind of lead the problem to take a mind of its own and, get worse and worse and worse. And, you know, if someone's been putting something off for like 5 years, how do you kind of work with that person to fix that issue?
Yeah, so I mean, part of that is it takes like a peeling back of layers. It's just like an onion. So like you have to sit with them and put to them, why are you here in the first place? Why are you here now? And why did you decide to show up today versus 6 months ago, a year ago? What has changed? And usually it's something that they won't even tell you. You know, like you'll find out weeks or months into your treatment with them that they'll be like, yeah, I've been able to start playing with my grandson. And I'm like, that's why you're here. It's not because you want to get out of pain with your knee. It's not because you want to avoid surgery. It's because you can't play with your grandson. You can't ride your bike. You can't run. You can't jump. You can't do this. You can't do that. And it's something that's been missing for your life. And most of the time, a lot of clinicians don't even ask those kind of questions. They will go through and they will give you the base level treatments. You know, like, well, how did this start? Da, 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 da. They'll break it down as far as like what your injury is and treat you as your injury, not necessarily as much as your person. And that's kind of what I like to delve into. Like, what are you missing from your life? What is keeping you from doing what you love today, and kind of breaking that down even further. So for someone that's been dealing with pain for years, I do ask those questions like, why now? What is keeping you from staying here today? Or what can I do to make you feel like the most valuable treatment that you can possibly get today? And then from there, once I have that one specific goal, I can break it down even further as far as like, how are we going to get there? We set those goals, whether it's weeks or months from now, because sometimes when things have been around for years, it does take months to get back. If it's something that's been around for a couple of weeks, it will take a shorter period of time. But if it's been around for years, it will take a while, because you first have to develop and make sure you have the appropriate mobility. And then you have to have the appropriate muscle activation. And then you have to have the strength. And then depending on the activity, if you're especially dealing in sports with which insurance companies won't pay for, and that's why a lot of my business deals with athletes, is giving them the appropriate transition between if they went to rehab and then back to sport, or if they're just coming straight to me from an injury. Like working with them to make sure that they're getting the power, the speed, and the agility in order to get back to their sport safely without having the years of, yeah, I've had shin splints on and off. My foot hurts. I have plantar fasciitis and I can't run X number of miles anymore. I feel like I'm getting old. I can't do this. I can't get out of bed anymore in the morning because my knees hurt. And that's not something that people can live with every day. You can get better, for those who are doubting out there. Getting the appropriate care that you need, the appropriate mobility and stability is first paramount. And then from there, you can build and build and build, getting to that ultimate goal that you came in for originally. Whether you know about that specific goal or you've been subconsciously thinking about that goal, making sure that you are understanding kind of yourself is part of the key with the sessions that I go through. Understanding why you're here, because when you understand why you're here, you're more invested. And when you become more invested, there's less likely that you're going to slide back, and less likely that you're going to, I don't want to say miss out, but I want to say like you don't slide backwards as far as your treatment goes. A lot of the times with standard physical therapy clinics, when people are being seen with 3 or 4 people at a time, they have that chance to slip because the physical therapist isn't only paying attention to them. The way that I deal with patients is that I specifically work with them one-on-one. And the fact is I give them very tailored regimens that you need to be serious about what you're doing, because I'm serious about your goals and getting you back to life. So ensuring that you have that kind of drive to make sure that you are getting better and having that why is paramount. Having a why in anything that you do, whether it is being a parent, being a grandparent, being an athlete, having that why, whether you want to be healthy, whether you want to compete against your friends, or whether you want to make sure that you're the greatest grandparent that plays all the cool games, that's what you need to be able to do. You have to have that why so you stay motivated throughout the treatment session.
I think that's a really, really great point because I actually went to physical therapy for back problems at one point, and I was laying on a bed. I was just like, all right, like, is this guy coming back? And then I know that you kind of touched on it earlier, but the insurance was crazy because my insurance was not the best insurance, and my copays were like $80 a pop. So,
Right.
it is something that people kind of get, for lack of a better word, deterred, I guess, from, because my chiropractor says that we live in a sick care system, not a healthcare
100%.
system.
100%.
And what you were saying before we hopped on here is you work a lot with preventative measures so people don't get hurt again or don't get hurt in the first place. And
Right.
if people are only going when their problem is at a point where they're like kind of at like a pivotal moment of like, hey, I can't deal with this anymore, then it's harder to harder to I'm trying to like connect this, but like harder to fix instead of easier to prevent, if that makes sense.
Yeah. So I mean, what I want to go off, since you are mentioning all these different topics of what I could be going into. I mean, as far as insurance companies go, it's getting worse. And now that COVID happened, I think it's going to tick up even more. I mean, from what I want to even mention from last night, my friend, she's up for her renewal for her insurance. And she told me that her premium went up already 30% from last year. And this was a lower plan than she had 2 years ago. And she went to the lower plan because she could not afford the medium plan that she had. And it has a higher copay, it has a higher deductible. And now she's like, do I just not have insurance anymore? Because I can barely afford this now. 10% of my entire yearly salary is going to just insurance. And yeah, so that's a lot. And that doesn't include taxes being taken out from her pay either. So the insurance game, and I call it a game only because insurance companies are what they are. They're companies, they're businesses. They want to make money. And based off of what they've been doing, I think with COVID, unfortunately, they tell us that, or fortunately, they tell us that COVID patients can get their treatment for free. Wonderful. But just like any business, nothing is for free. You will get charged somewhere else. And I feel like what they're going to be doing as far as insurance rates go is that it's going to increase, just like with my friends last night, even further than it has been year after year of the course 5 to 10 years. It has not been getting cheaper. And for regular insurance companies, physical therapy clinics, reimbursement is going down. So you're going to see less and less of us being able to keep up with insurance companies. That's another part of the reason why I went into this, because on top of the pay that we were getting, we were forced to see many, many more people in a single hour than we should be seeing. We should be one-on-one with you, because a lot of people that have comorbidities, and these are the people that do come in that have these chronic conditions, they need somebody with them, and not just a technician who only has a couple of weeks of training and then learns everything else on the job. You need that doctor sitting next to you all the time, making sure you're doing it correctly. Now, I did my best while I was in that company to do so, but at the same time, I felt like I was still missing out on a lot of things I could have been doing with people, only because I did not have the availability, because I couldn't be more on time with them. As far as how my company works, it's a premium level service. You are working one-on-one. It's a different level of service that you don't get anywhere else. Not the fact that it's just one-on-one. You get 24-hour service with me. So if you need a question, or if you have a question, if you need some level of modification in your program, you can contact me at any point. As long as I'm awake, or as long as I'm not with another patient or spending time with my family, I will respond to you, and I will get back to you immediately as soon as I see that message, so that you're able to get the intervention that you need right away. And that's something that does cost a little bit more than your copay. I will tell you that. And there's a reason for that, only because it does take a lot of time to give you that care. And, it is not for me to make millions of dollars. I will tell you that. And that's not my goal. It's to make sure that you are getting a great level of service and a great level of care. And that's my number one goal, to make sure that everybody on Long Island receives that care, whether I'm going to subconsciously or behind the scenes take down the insurance game. I have no idea. I don't know where my career is going to take me. There's hundreds of other physical therapists and other healthcare practitioners, not just in the physical therapy realm, that are trying to not necessarily fight against insurance companies, but at the same time give people different options for them to use their services or their availability of services so that they're able to get what they want rather than what they think they're going to get. Because if you go to a regular physical therapy clinic, you may not get what you want. And just based off of what you said, you sat on a table and you laid there waiting for someone to come to you, not knowing when they were going to come. That shouldn't happen, number one. And two, if someone's standing across the room and pointing for you to do this exercise and that exercise without even helping you set up the exercise, go find somewhere else to go. You should have that person next to you working with you, because that's what you're there for. That's what you're paying money for. And that's the kind of level of service that you deserve as a person.
So you mentioned that your business works a bit differently. What are some of the services that you provide, like specifically?
Yeah, so I mean, you know, since COVID happened, or even before COVID, like I was always working with people who either had orthopedic injuries is my main practice, whether you're surgical or non-surgical. Athletic injuries, whether that is acute or chronic conditions, whether you sprain your ankle or if you have plantar fasciitis, shin splints, IT band syndrome, low back pain, sacroiliac joint pain or SI joint pain. My low back and SI or sacroiliac joint game is pretty strong. I do know more advanced techniques in those areas, so that's definitely my bread and butter. I worked with someone over the course of this COVID outbreak. One of my friends, he was not getting services that he needed, and he was worried about walking into a clinic only because he had different comorbidities that would put him at a high risk for not doing well if he did catch COVID from a facility. And especially at the beginning of this outbreak, a lot of facilities were not maintaining CDC guidelines across the country. And they were having as many people packed in as they could just before if they had to shut down. So unfortunately, things weren't being followed. But yeah, he was like, I don't know what to do. I don't know how this is going to work. I have tingling in my fingers. I have pain in my back and my shoulders. I can't sleep at night because I can't lay on my sides. I don't know what to do. I do yard work and then I get tremors in my hand. What can I do? What can you help me with? So I broke it down. Like, he was avoiding working with me because he didn't think I could do anything virtually with him. And he finally broke down a week later. Like, I didn't hound him, but at the same time I checked up on him every couple of days. I was like, how's it going? What's going on? And he would tell me, like, my symptoms are the same. They're not getting any better. And some days he would tell me they were getting worse. So I was like, dude, just do this one session with me. If you're happy, we can keep going. If you're not happy, fine. So I do kind of give that money back guarantee kind of thing to people. If you're not happy with the care I give you, I'm more than happy to give you your money back. Just because, you know, I want to make sure that you're getting what you want. And if I'm not giving you what you want, then I don't deserve to be paid. That's how I feel. But within 4 sessions, he was basically pain free. And that's 4 weeks. I tend to see my patients 1 to 2 times a week, depending on their needs. I was following up with him 2 to 3 times a week between sessions, just to make sure he was doing okay and make sure the exercises were doing all right. And 4 sessions, he went from being able to do anything outside of basic yard work and his basic job, which was a lot of the time sitting on a computer, to doing whatever he wanted without having to worry about it or worrying about having to be out of commission on heat or on pain meds because he pushed himself too far and was in dealing with pain, and he was pain free. So I mean, virtual physical therapy is one thing that I do right now, just because I'm still under lockdown, not seeing people physically until for like at least the next couple of weeks, depending on what happens with the opening up of Long Island. So virtual care is what I'm giving right now. In my regular practice, I am mobile. So that's a different feature that is different from most. I'm not the regular home care therapist that will come and you've seen work with your mom or your grandma that does a couple of knee kicks and goes on our way and just sits and does paperwork and I'm late all the time. That's not the kind of person I work with or the person that I tend to hang around with. Like I arrive on time. I make sure that I'm at your house or your office, wherever you need me to be. If you need me to be at a field to ensure that I'm seeing how you're running or how you're jumping or how you're riding your bike or whatever your sport is, I can work with you in order to get to where you are so that we can work physically in the field to get to where you are. So if I need to be in your home, I work with you. I use whatever equipment's in your home, or I have a whole backpack that's at least 50 pounds worth of equipment that I bring with me to help you out. And additionally, I have a table that if I do need to do any manual techniques, I do that as well. The basic breakdown of a session goes, like especially the first session, I go through an evaluation and kind of break it down as far as what your needs are, what areas we need to work on, because it's not just the painful spot, it's the spots that are in your limb. So your entire leg, or if it's your back, it could be your neck or your hips as well. So I definitely take a full person look, not just your joint or your area that is painful, because chasing the pain is not going to make it go away. I get to the exact cause, not the symptoms of what you're dealing with, so that you're able to not have to worry about something like that coming back.
I think that's really important. And, whatever it is that is wrong with someone, it's usually manifested in symptoms, but you have to get to that root cause to actually relieve all of those symptoms instead of treating the symptoms, correct?
Correct. Yeah. I mean, a lot of the times, like you see, I've had a lot of, even this goes, let's start that again. So, I mean, I can break this down even further. I mean, you can take a look at this as even just COVID, because a lot of the stuff that we've incorporated, if you think of everything, I mentioned this yesterday in my live. So if anybody here wants to follow me on Facebook, I do lives every Tuesday. So follow me on those lives and you can definitely see how I talk about it. But yesterday I spoke about how a lot of the gloves, the masks that we're doing, the staying at home, that's a defense. And just like any team in sports, a lot of us, we watch soccer, we watch football, we watch baseball. We have teams, we have offense and we have defense. What's the offensive? And a lot of the times that comes in the line of doing that preventative work. And, like a lot of people miss out on that, and they're misguided on it. A lot of coaches, a lot of physical therapists, they give you as far as physical therapists go, they give you the heat, they give you electrical stimulation, they give you the ultrasound. Those are all palliative things that treat symptoms, not causes, and will continue to allow your condition to work. Exercise, movement, in sometimes manual treatment, it is a palliative thing, but sometimes that can kickstart what you need in order to get you to a place faster, because I'm able to not necessarily position your joint, but put your joint into a better mechanical alignment so that you're able to move better. Whether that is loosening up a muscle, giving you a joint mobilization to make your joint more free, and keeping less stress on that joint so you're not kind of compressing it, allowing you to move in a more biomechanical kind of way that you're supposed to as a human. So making sure that you're doing that kind of stuff as a practitioner is important. And going back to COVID, that offense that we need, well, if you look at the predisposing factors, or not predisposing factors, like the comorbidities that happen, it's diabetes, it's high blood pressure, and it's generally people over the age of 65 is another one, and obesity. Mm-hmm. And, because we have our sedentary lifestyles as people in the United States, I'll just generalize that as a whole, mm-hmm. Not just Long Islanders, or not just people in the South, or people in mm-hmm. California.
Of course.
It's making sure that you are active, and it's finding not necessarily like, oh, I have to go run. I fucking hate running. I'm sorry I cursed, but at the same time, it's finding that thing that you like to do, whether that's gardening. That can be considered your cardio work. If you like gardening, that's what you love to do. If you like to go for a walk, that's what you like to do. But at the same time, do you need to do some level of resistance training? Yes, especially ladies. I know ladies don't like to do a lot of weight training. But doing that behind the scenes, or whether you're doing lighter weights, and I'm not just talking about 1 pound, but doing something that's significant that stresses your bones, your tendons, and your muscles to build some level of a platform that you're able to do function off of, will prevent osteoarthritis, will prevent osteopenia and osteoporosis or weakened bones, and will keep you stronger, not only as a person, but keep the integrity of your joint stable. So that includes your spine. A lot of people, as we get older, we will have changes that occur. After the age of 30, we start to go downhill, regardless of who you are and how fit you are. We all start to have some level of changes, but even the most up-to-date research, you go into it and you find that running and impact activity, I know a lot of doctors and a lot of other practitioners say like, oh, running's bad for you, jumping's bad for you, strength training's bad for you, that kind of stuff. You can hear it all the time, squatting's bad for you. And most of the time, that's not the case. It just depends on how you're doing it and make sure you're doing it correctly. And that's where a lot of people fall short, making sure that they're doing it correctly. That's kind of where my practice goes into as well, making sure you're doing everything with form. And that's what a lot of my education goes into as well for the people that or the postings that I do. And then on top of that, making sure that you're getting where was I going? Now I lost my place.
No worries. I think that where you're going with that is making sure that you have proper form and making sure that you're educated in what you're doing so that you don't hurt yourself.
Right.
We actually have a question, and this kind of loops back, and maybe we'll talk about, some identifying factors for people for a couple of the things that you mentioned earlier. It says, any tips on dealing with plantar fasciitis? I haven't been medically diagnosed, but my feet hurt almost all the time, and I wouldn't be surprised if I had it.
Okay. Yeah. So I would say that for most people, their main symptom for plantar fasciitis is pain right by the base of the heel, usually on the inside of the heel. That's usually the bigger symptom that most people get. Otherwise, they will get pain on the bottom of their foot entirely. A lot of practitioners, when they deal with this, they will do the whole stretching your calf. They will go into the rolling something under the bottom of your foot. And is that some level of treatment that I provide with my people? Yeah. Is it something that I usually give them to do at night sometimes when they're sitting watching TV? Yes, because it is something that I can very easily do. But is it where some practitioners stop? Yeah. Will they strengthen sometimes their feet? Yeah. Will they strengthen the ankle a little bit? Yeah. But at the same time, this kind of goes back to what I was talking about before of where things generally stop. Depends on now, a lot of the times, plantar fasciitis will depend on the activity that you deal with. So whether you're a runner or you're just a general, if you're just somebody who just lives life and goes to work, goes to play with your family or have fun with your family, that kind of thing, hang out with friends, regardless of what kind of person you are, it depends on how high your treatment goes. A lot of the times what people miss is the tightness in the calf. Usually the smaller muscles that are in the inside of the calf that usually get missed as far as the tightness, and that's usually the pain points that people miss, only because those muscles are very small. The muscles that are deep in the calf that are not like the big muscles that you can feel if you reach down and touch your lower leg right now, they're behind those muscles. You can only reach them from the inside of the calf right behind your shin bone. And a lot of times I will get in there manually. Does it hurt sometimes? It can, but I try to make it as painless as possible for them. Getting in there and massaging that out and working on different trigger points that I do find in there. And the reason why that these get tight is usually because either the smaller muscles that are inside the foot are not as strong as they should be to support your foot structure or the arch in your foot, on top of usually core, like abdominal weakness and hip weakness, and also the ability to transmit force up your leg and being able to absorb that force and then put that force back into the ground to go into, say, like your next step while you're walking. So kind of condensing that just so I can work on the top components of that, just so I'm not confusing anybody. Tightness in the calf is the main cause of it. If you're having that, definitely go off an edge of a step, stretch out your calves. That's one thing you can definitely do today. Hold that for 30 seconds, do that 3 times. That's definitely a good way to start. You can massage the bottom of your foot, but don't forget strengthening your foot, the smaller muscles of your foot, whether you have to pick up small objects like a marble or a small ball with your toes. That's one thing I like to do with my people. Working on gripping the ground. So if you want to grab a towel with your toes, that's another thing you can do. And strengthening your hips and your core. So whether that's doing crunches, that's one simple thing, but also working on stability exercises like planks. That's definitely a higher level thing to go, but there's definitely smaller things that you can work into, especially if you have prior history of back pain, but also strengthening the muscles in your hip. Those are the key points I definitely wanted to kind of condense everything with.
That makes a lot of sense. And it makes a lot of sense that there's a lot of things connected. And you just brought up lower back, which is one of the things that you work on a lot. And you said you have a pretty good lower back game. So when people have lower back problems, where does that stem from a lot? And I say that as I'm sitting in like a desk chair.
Yeah, I mean, is that the desk chair from IKEA, by the way?
No, but I have the desk chair from IKEA downstairs. So, you know, okay. I got you.
I mean, surprisingly, the one I got from IKEA is actually pretty good. So I think I'm like a poster child for IKEA now because I continue to promote that chair. But, you know, it is good. Anyway, as far as when I get with back patients, this I can take for a whole other topic. But I'll try and condense it as much as I can. As far as back pain goes, a lot of it does come from that sedentary lifestyle that we have. We wake up in the morning, we're laying down, we're not really doing much activity in our body. We go from laying in our bed to sitting at the breakfast table if you have breakfast in the morning, and you're sitting. You get up, you go to work, you're getting ready, you're up for a couple of minutes, 20 minutes maybe, 30 minutes, maybe an hour. Then you're driving in your car. I think the average commute time is about 20 to 30 minutes, but it can be up to a couple hours for some people. So you're sitting for that long. You get to work. A lot of people sit at desk chairs now. They're working on computers. You're sitting for how many hours? What people fail to do, especially those who sit at work a lot, is they fail to get up periodically. I once had a patient who had the office record of being able to sit in his chair, which was for the entire shift, of course. But then he came to me for his back pain. And for him, that not only involved fixing his back, because his issue actually stemmed from lack of mobility in his knee. He was not able to fully extend his knee. So once I was able to fully extend his knee and able to fully get extension in his hip, or being able to bring his leg behind him, he was able to straighten up more. And because he was able to straighten up more, he had better force absorption from the ground when he takes steps or when he's doing activity. And then he was also able to sit better, and also he was able to work more appropriately and get back to running. So it's definitely looking at that whole body. It's not just the back pain as what it is, and it's back pain. It's making sure that your feet, your ankles, your knees, your hips are working just as well. Because if I want to take it this way, and this will keep it as condensed as possible. When we put force into the ground, it's just like, if you remember back from physics, Newton's third law of motion, you put force into the ground, you get that much force back. And if you're running or you're jumping, you're getting X number of times more of that force, and you need to be able to absorb it. So if your body, whether it is a weak spot in your ankle, a weak spot in your knee, a weak spot in your hip, and you don't have that stability, whether it is the stability of the joint itself, or if it's the stability in your muscles to maintain the appropriate form to support the activity that you're doing, you will get that force transmitted somewhere, whether it is from your foot to your knee, from your foot to your hip, or from your foot to your back. And I just use that as an example. So if I have that compression in my foot and I have that pronation that everybody talks about, that a lot of people have, and I'm not able to maintain that stability, that force is going to travel up my leg. And if it travels up and stays in my back, I will have that extra force in my back. And if my core muscles, my abdominal muscles, and not only my abdominal muscles, but my hips as well, and my pelvic floor muscles, if they're not strong enough to support everything, something will break down. And usually that is your discs, and that usually is your joints. in your back. You do have joints in your back, and that's not only the spaces between your vertebrae that has your disc between it. A lot of people, when they have back pain, they do freak out, and I completely understand, because you feel like you physically can't do anything. Personally, for me, I've had SI joint or sacroiliac joint issues in the past, and I have fixed myself a number of occasions, and that was from weakness in my hip. And once I fixed that, like that was, I haven't had issues, knock on wood, for a number of years now. But on top of that, it's making sure that you have that framework that I was talking about to work from, and not having that framework is paramount. I mean, when people have that first onset back pain, or if you have chronic back pain, it can be debilitating. And a lot of people, or from what they're told from family members, whether they're older family members who have been through it before, their doctors, other friends, family members, they all say, oh, rest, rest, rest. It's okay. It's going to go away. Just let it rest. And that's usually not the case anymore. Mm-hmm. Resting is not what's going to help you. Heating is not what's going to help you. Making sure that you're taking it easy sometimes may not be able to help you. What I recommend for all my back patients, whether it's an acute onset of a chronic condition or an acute onset like a brand new back pain, or if it's doing as much activity as you can is better than nothing, but trying to keep your symptoms at a certain level. Like if you're going over a 5 out of 10, where 5 out of 10 is I'm pretty uncomfortable, and 10 being like take me to the hospital now, keeping it at that around that 5 level or below is what you kind of need to be around. Using ice to help decrease spasm. A lot of people don't talk about using ice, but ice is what's going to help keep that spasm and inflammation down, and also take care of pain a little bit longer than heat will. Even though ice is a little bit uncomfortable, and rightfully so it is, but at the same time will give you that little bit longer relief. But then also trying to, again, try not to be laying around in bed, because as I was mentioning before, once you start laying around, or once you start sitting, or you continue to modify your activity and stop your activity, if you've done that for a couple of weeks and modified and still haven't gotten any better, see somebody. See someone like me, see a doctor, see a physical therapist that is qualified to help you with your low back issues. Just because if you're there for a couple of weeks, you've already lost muscle mass. If you look at ACL or anterior cruciate ligament, any of the terrible knee issues that you see a lot in football players and soccer players, once you start having an injury, once you have swelling in an area, once you have inflammation, your muscles shut down automatically. It's a reflex. And if you laid in bed for 3 days and you had that kind of an injury, you lose about 20% of your power production and muscle mass within about 3 days. So sitting around is not what's going to help you. Getting active and getting the help that you need is what's gonna help you get back and get you the life that you wanted. One last thing I wanted to talk about just on this topic, I had a patient that he had years of back pain, and he was a postal worker, and he blew out his back moving something in his garage, and he blew out his back. Now, when I talk about my sacroiliac game, like I have a specific technique that I learned from Jerry Hesh called the Hesh Method. And that's a very specific guided way of looking at the sacroiliac joint and pelvis to ensure that it's moving appropriately, because every step that you take, your pelvis should be able to move and glide a certain way. And some people certainly do get stuck in a position, and it's pretty common. And usually that will cause back pain and possibly also hip pain. And even thigh pain, just because the muscles are trying to do what they're supposed to do, but they can't do it. So basically that was kind of what was going on with him. And I was able to work with him because he had years. It took me 3 months to kind of get him back to where he needed to be. He was back able to ride his motorcycle, and he was able to deal with his work load, that he was carrying boxes and he was carrying bags of heavy objects, and was able to do so without having that fear. Did he have a couple setbacks? Yeah, because he advanced more to the activity because he felt good, and he set himself back. I was able to put him right back together, and within a couple of days, he was back onto his plan. But at the same time, it's definitely that it's going to take a while if you've been dealing with it a while, but you will get relief. You just got to keep working towards got to keep looking forward. You can't look back.
So I know that you were talking about like people kind of getting sedentary, and that's kind of a relevant topic now that everyone has been home for what, 2 months, a little over 2 months, with coronavirus. So, what would be your advice for now that everything's opening up again, for getting back into the groove of things and kind of enforcing the becoming more active aspect of that?
Right. Yeah. So, I mean, like, I don't like that we have had to deal with this coronavirus. I don't like it. I don't like to see that we've had so many people die, especially people that I've had, whether family or friends or friends of family, die or have become very sick as a result of this. But at the same time, I feel like the good thing, I try to look at the positives in everything. And the biggest positives that I've seen is I think families are closer. Mm-hmm. I feel like, in essence, in some cases, I've, crime rates have been up for domestic abuse, but whatever. I think people and family have been a little bit closer in general. I think, and I've seen a lot more people out. And this was even at the height of it. I've seen more people out walking. I've seen more people out running in my neighborhood than I've seen in the years that I've been here. And I think it's fantastic. I'm hoping that people are maintaining distance a little bit from people, because I do see a lot of people without masks on. And if you're someone who does not like to wear masks, that's okay. Just keep your distance. That's all I ask. Whether you feel like you're a carrier or not. That's kind of like my bottom line for that. But as far as getting out and not being sedentary, like I said before, do something you enjoy. That usually comes to the bottom line of it. If you don't know what you like, get out and explore. That's the best way to kind of jump into something. And you don't have to go out and be that person who goes hardcore, balls to the wall, and after day 2, you're kind of burnt out and you don't want to do it anymore. If you're someone who hasn't gone out and walked just to walk, it can be something that's meditative. It can be something that you never realized can get out and let you think. A lot of people, I think a lot of the times where we run into the mental health kind of side of this kind of crisis is the fact that people aren't used to dealing with themselves and having to think of who they are as a person or what kind of life they've been living. And sometimes people find that they're not happy with who they are. Mm-hmm. They're not sure what to do. And what sometimes you can do is just get out and think. And sometimes that can be just a walk, whether it's walking around the block once, taking a seat, and that could be your day. And if next week you want to go out and do two times around the block, that's fine. Just as long as you're kind of progressing and moving forward. That's kind of where you need to go. Like I said earlier, if you want to garden. I mean, I've seen friends on Facebook. I'm like, you garden now? And they're like, yeah, it's great. I find it's fantastic. I'm just like, all right, I'm happy you're outside. That's perfectly fine. But yeah, I mean, doing something that's active, whether that's riding a bike, if you need to get a bike. I mean, if you need recommendations, I definitely have recommendations for you. If you want to just go out for a run, if that's how you feel it, that's completely fine. If you want to learn a new skill, like if you want to learn how to weight lift, perfectly fine. If you want to just learn how to swim, that's another thing you can do. I mean, pools are closed right now, but the beaches are open according to the governor, and Dax Bay is pretty free and it's shallow. So if you want to learn how to swim or get into the water, it's a little cold, but it's definitely a good time.
Makes sense. I like that. You're stressing the point of like gardening can be an active thing. Cleaning your house can be active. Just going for a walk. It doesn't mean, you need to go buy ankle weights and you have to go do this and you need to figure out how you're going to be lifting things with like bags full of cans of soup, like, because I've seen people doing that kind of stuff. But, just incorporating something active into your day to keep you going and keep you, I guess, moving.
Yep. I mean, at minimum, if you want to go by CDC guidelines, 20 minutes is what you need to be at. But at the same time, if you want to start at 10 or 5 minutes, I'm not going to stop you. If you build up to that 20 minutes, or if you end up doing like 2 or 3 hours of gardening and you're completely fine doing it.
There you go.
Right.
That's awesome. So, Rob, we are coming up towards the end of the hour. I was wondering if you have any final thoughts that you'd love to share with the audience, and then also let them know how they can get a hold of you if they would like to follow what you do, watch your lives, or maybe even work with you.
Yeah. So, I mean, like my closing points I wanted to say to everybody is just, make sure you're finding happiness in life, making sure that you are loving what you do, whether that is what you do for work, whether what you do at home, whether what you do with your family, or what you do for yourself. Being healthy is what you have. Your life is what you have. You only have one life to live. And being there and living the healthiest life you can is what's going to keep you there, even in your older years. Staying active as you can into your later years will keep you longer and happier. A lot of us work so that we can retire and so we can enjoy retirement. But a lot of times when people get to retirement, they're physically unable to enjoy their retirement. So I want to make sure that you guys stay active and healthy. And if you guys are having trouble fitting in that time, I can help you guys work and build in that time. Like I said, it only starts with 5 minutes, and it can only build from there. The other thing I want to talk about real quick is just making sure that you are staying safe, especially around still that COVID is still around. It is at the lowest levels it has been since March, but at the same time, we don't want resurgence because we don't want to be shut down. And even if it doesn't get shut down this time, I still don't want any more people dying. So please stay safe. Please wear a mask. Please stay distanced as much as you can if you need to, especially in social gatherings. If you want to find me, I do lives on my Facebook page. So follow me or add me as a friend on Facebook at Robert Berghorn Jr. And I'm sure Celia has that written somewhere or broken down.
Yes.
Down in the description. If you want, I have my Facebook page that is also for my business, Ascent Physical Therapy, PLLC. I'm on Instagram at Ascent_multisport _PT_multisport. Sorry about that. I'm on Twitter at AscentPTNY. And I have my YouTube page, Ascent Physical Therapy. I have been going through a series this past few weeks, and it will be going on for another 6 weeks on developing a training plan for athletes. This is not only applied just to athletes, even though the wording is specifically for athletes, but if you want to start becoming more healthily active, the still basic principles that are included in there, getting you that mobility, getting the strength and stability, getting the power that you need in order to do your activity is what you need in order to function appropriately, just even as a human being. So following that series is definitely something that you could be doing as well. And I will be putting out further series. If you guys have any tips or if you guys want any specific information, please message me directly. I'm more than happy to talk to you guys. If you guys have any questions, please feel free to reach out. If you want to specifically work with me, you can contact me through my phone number, 516-387-4669. It's 516-387-4669. And that will be able to contact me on my business phone, and that will be able to help guide you whether you want to just message me if you're not comfortable talking with me right away about what you've been dealing with, but also trying to get you the thing that you need, whether you just decide to work with me, or if you just have a simple question, I'm more than happy to answer that question for you free of charge. My way of work is just to give you what you need. If you decide to work with me under my paid services, that's completely fine. I'm more than happy to work with you. And that's tailored to whether you want to prevent injury, whether you want to get out of pain, or whether you want to become a better athlete as far as an endurance athlete, runner, cyclist, swimmer, triathlete, whatever it is that you love doing. I'm more than happy to help you get to your goals.
That was a really good wrap up. You know, I've been a guest on certain shows, and I did one this morning, and it was like, how can they get a hold of you, and like, what's the deal? And it's always, oh wow, I'm on all of these social medias, and there's this and there's that, and there's the email and there's the phone number. Nice job.
Thank you.
So I want to thank you for coming on today. I like, especially because I have a little background in this, I can tell how knowledgeable you are on this topic, especially because, you know, you're talking at such a high level, but you're making it understandable for someone that may not be able to, you know, understand certain lingo and certain terms, which is
Right.
amazing. So thank you for coming on and, you know, getting into, you know, different areas of this. We talked a little bit about the insurance. We talked a little bit about different services that you provide, different, I guess, what did you call it? Comorbidities that people have and kind of identifying them, and also some case studies. So we covered many different things, and I think that this episode will be able to help a lot of people. So once again, thank you. So I'm going to pull you off of here, and I'm going to wrap up the show, and then I'll have a quick thank you off screen, and I won't keep you for too much more of your day.
Thank you.
All right. So big thank you to Dr. Rob for coming on today and talking to us a little bit about what physical therapy is, what kind of comorbidities, because that's the new word of the day that I'm going to incorporate whenever I have someone in the healthcare field on, you know, and having kind of a widespread informational session about the world of physical therapy and, you know, learning, because learning is the best thing that we can do right now. And I'm so glad that we were able to actually pull off this episode today. So if you want to watch this episode from the beginning, you can watch it here on the Celia Werner Productions Facebook page. You can, you know, start it over and watch on through. It's going to be on YouTube, Spotify, Apple Podcasts, Google Podcasts, and SoundCloud. And if I can find anywhere else to put it, you gotta find it there too. So thank you guys for tuning in with us today, and I will see you guys tomorrow.